Thank you, Madam Deputy Speaker. I congratulate the Honourable Member for Tooting on securing this debate and the tremendous work she does in this area, both in this House and as emergency doctor in the NHS. Madam Deputy Speaker, I want to begin not with statistics, but with something that happened to me. Last year, at about 9 p.m. in the evening, I stood up to go to watch a film with my family, but suddenly felt faint and nauseous. Home blood pressure machine showed that my reading was over 200. I went to an A&E, I was seen, and a CT scan was arranged. Then I sat on a chair in what was essentially a public waiting room where I stayed for the entire day. I had my scan, my blood test, everything whilst based in that room. It was only in the evening later that I was managed to get a bed on acute unit. So I spent 24 hours in effectively what you would call a corridor. The next day I had an MRI and then went on to see a neurologist and a stroke team. Let me be absolutely clear. I do not blame the hospital and I do not blame the staff. They were professional and compassionate throughout. But they are working under chronic pressure in a system that simply does not have space or the beds to care for patients as they would wish. The first official NHS England data on corridor care, published last month, showed that at the Royal Bolton Hospital, an average of 13 patients a day were treated in a corridor spaces in May. I welcome the honesty of the Trust's Chief Nursing Officer, who said that even when one patient is cared for in this way is far too many, and I commend the Trust's commitment to eliminate the practice ahead of the National Time Framework. But Bolton is not an outlier. It reflects a national emergency across the United Kingdom, and about 2,200 patients experienced this just in any day in the month of May, while many hundreds were treated in unsuitable spaces. Nearly 148,000 patients waited 12 hours or more in an A&E that month, the worst record in May. And the Royal College of Emergency Medicine warns that the official figure may still understate the true scale. This is not just undignified, it is deadly. The Royal College estimates that in 2025 alone, there were over 15,800 excess deaths associated with long waits in the emergency department. The uncorked study found that corridor care leads to longer hospital stays and a greater risk of death. There are many reasons for this delay, and many of them have been mentioned, but bed occupancy is running at 93%, far above the safe level of 85%, while some 13,000 beds are occupied by patients who are medically fit to leave but cannot be discharged for want of social and community care. So I asked the Minister, I know the government has spent a lot of money in the NHS, such as getting rid of the, ending the doctors' dispute, but will they now commit to a full commitment to ensure that corridor care does not occur in our country and that no patient in the United Kingdom or in Bolton or Walkden or anywhere else spends a day of acute illness on a chair in a waiting room? The staff of our NHS deserve better, as do our constituents.